Hello, everyone. Thank you for joining today's presentation from the Health Connector. Today's presentation is called Health Connector for Business, Affordable, Flexible Health Coverage. We do have a number of participants who have signed up, but we're going to plan on getting started at 12 as scheduled. Excuse me, 11:30. So I am Melissa Stearns from the Massachusetts Health Connector, and I will be facilitating today's session. I am going to be joined by my colleagues Shaitra Sanders and Nikki Conti, and we're here to help answer any questions you might have. I'd like to take a moment to thank the chambers, business organizations, and brokers across the state for their support in promoting this webinar. So before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 25 to 30 minutes, and then we'll have time for a question and answer period at the end. If you'd like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout the presentation. Please do not disclose any personal information or protected health information when you ask your question, as we will not be able to answer those in full detail here on the webinar. If you have a specific personal scenario that you want to discuss with someone, we will be providing contact information for the Health Connector's customer service centers, as well as instructions on how to find help from a local broker or a navigator. We are recording today's webinar. Following today's presentation, you'll receive an email with the presentation, so there's no need to take detailed notes today. All right, well, with that, let's go ahead and get started with today's presentation.
Thanks so much, Melissa. And as Melissa said, I'm Shaitra Sanders, and I am joined today with my colleague, Nikki Conti. I'm going to talk a little bit about Health Connector for Business and the opportunities for employers who have 1 to 50 full-time equivalent employees. And then Nikki's going to come on right after that and provide some information on business owners that may be sole proprietors, entrepreneurs, family-run businesses, owners who are enrolling without employees, or even just employees who might not have access to health insurance. She'll provide some information available for them to get health insurance. So let's go ahead and get started. Health Connector for Business, affordable, flexible health coverage. So just to give you an overview of what we'll be discussing today, we'll let you know what the Health Connector is. What are the employers' experiences working with the Health Connector for Business? What kind of savings have they found through comparison shopping? Utilizing the flexible choice models, rebates that are received through our Connect Well program, as well as rebates that can be received through the Small Business Healthcare Tax Credit. We'll explain how to go ahead and get started on the Health Connector for Business and follow that up with Health Connector products for sole proprietors and owner only. So a quick overview of what the Health Connector is. The Health Connector, just to let you know, is the Massachusetts health insurance marketplace, the state's health insurance marketplace. And our goal is to offer coverage to individuals, families, and small employers across the state. So I'm going to talk about the business part, and that's the offering of small group coverage to employees through the Health Connector for Business. There's also the option for those who can't get health insurance through their job or other sources that can apply for our individual coverage. There's also some savings due to the American Rescue Plan that Nikki will talk about when she talks about the opportunities for sole proprietors and owner only. And also, just to let you know, we're not just talking about health insurance. People can also buy dental insurance through the Health Connector and Health Connector for Business. So just to provide you with a little bit of an idea of what we mean when we say we're the state's marketplace, we have all of the leading insurers available on the Health Connector and Health Connector for Business. So it's like a one-stop shopping solution. So when you're looking at this slide here, maybe all or at least most of these logos are familiar to you because these are the leading insurers here in Massachusetts, and we have them available with exclusive cost savings and flexible choice benefits on the Health Connector. So the Health Connector for Business. Health Connector for Business, just to let you know, is designed for small employers here in Massachusetts to offer their employees health insurance. And when I say small business, I mean business that has 1 to 50 full-time equivalent employees. And the goal of the Health Connector for Business is to maximize access and affordability for small employers. And we have found that we are able to really offer great savings and benefits to our employers and their employees through several different options. First being the full carrier participation. As I said on the previous slide, we are the only place in Massachusetts where small groups can access every single leading carrier in the marketplace. We also have competitive premiums. And I'll discuss this a little bit through the comparison shopping, but small businesses have found that they save over 20% on average before any rebates by shopping through the Health Connector for Business. Then pull into rebates. We have wellness rebates available. We have the Connect Well program, which I'll talk about in a little bit more detail, but that allows for employers to receive back 15% of what they put into their employees' premium contribution if their employees complete one of our 30 pre-approved wellness activities. We also have flexible employee choice that's exclusive to us. This allows for an employer to create like a cost constant plan or a budget plan while allowing their employees to shop for different plans that best suit their needs. And I'll explain that more in detail. There's also certified assistance. We actually have over 470 certified brokers available on the Health Connector for Business who can assist you for free on choosing the right plan for your company and your employees. Also, please note that you can have peace of mind when shopping through the Health Connector and the Health Connector for Business because all of our plans meet federal and state coverage requirements. So just a little bit of some highlights that may interest employers. A health savings account plan, so if you have a health savings account plan benefit also providing to your employees, all the carriers on the Health Connector for Business have at least a silver level health savings account compatible plan. So you can have that benefit existing and also offer your employees a plan that is compatible with that benefit. We also have out-of-state coverage. If you have any remote workers or someone working out of Massachusetts, we have access to PPO plans for them, and those will be through the one carrier model. And I'll talk about that in a little bit more detail. And like I said before, all of our plans meet the state's minimum credible coverage and have received our Health Connector seal of approval for quality and value. And when I say minimum state coverage standard, in order for there not to be any tax penalty to a person covered by health insurance here in Massachusetts, their plan has to have at least these 10 benefits. So if a plan didn't have one of these 10 benefits, the person who was covered by the insurance would not have full comprehensive coverage. So this is available. These minimum benefits are available on all the plans on the Health Connector and the Health Connector for Business, as well as some plans may have even more benefits, but they all have the state's minimum coverage standard benefits. So what are employers' experience with the Health Connector for Business? What we have found through our surveys to employers who offer health insurance through the Health Connector for Business is that small businesses that shop on the Health Connector for Business actually save on average about 20% by shopping. And mainly that is because, like I said before, we're a one-stop shopping solution. So when an employer comes to our platform, they can actually shop in one place and compare costs and compare benefits and compare what best works for the budget for the business and the budget for their employees, and also what is the best benefits for their employees. So on average, we have seen that a business that comes to us could save about 20% by shopping. We have also heard back from employers through our survey that they really appreciate these 4 items, which is the employee choice models, which I'm going to talk about again in a little bit more detail, the Connect Well rebate. Again, I'm going to go into more detail about that. The small business healthcare tax credit, that's a federal tax credit that allows for employers to receive back a rebate if they meet certain criteria. And also to utilize the Health Connector for Business, there's no fees or membership dues. So you do not have to pay to utilize us or utilize a broker. You just pay your premium. So let me go into the employee choice models. So if you recall, the goal of our employee choice models, which again is exclusive to the Health Connector for Business, is to allow for employers to control their costs while providing multiple insurance options to their employees. And since our platform is completely online, meaning everyone just has an online account, employees can easily compare options and choose a plan that best fits their needs in their account after you, the business owner, offers them a health insurance benefit package. Now, the employee choice models, there's 3 of them. They're called one plan, one carrier, one level. So this is the overview of it in health insurance speak, but I'm going to talk about it in comparison to pizza. So how does one plan work? If you and your employee were going to share the cost of a pizza, in the terms of one plan, you would say to your employee, hey, you can have a pizza. I'm going to pay for half of it, and you're going to pay for the other half. Let's just say that's the contribution. But under one plan, you make the decision on what pizza the employee is going to get. So you actually say to your employee, I'm going to share the cost of a pizza with you. It's going to be the $10 pepperoni pizza from the pizzeria down the block. I'm going to pay for half of it. You're going to pay for half of it. You get the pizza, but that is what I'm offering. So in one plan, when we look at health insurance, what you as the decision maker are doing is saying, I'm going to offer you this health insurance plan from this carrier, and I'm going to pay a certain percentage of it, and you're going to pay the other percentage of it, and that is going to be your health plan. So that's one plan. That is one of the traditional ways of offering health insurance here in Massachusetts, and we do offer it on the Health Connected for Business. Now, one carrier is unique and exclusive to the Health Connected for Business. Let's think about pizza. So you say to your employee, I'll share the cost of a pizza with you. You get the pizza, but I'll share the cost of it. You take a look at the pizzerias in the area and you decide what pizzeria the pizza is going to come from. You then look at the menu and you say, the business can afford to pay for half of the $10 pepperoni pizza. So you tell your employee, the business is going to pay for half of the $10 pepperoni pizza from the pizzeria down the block. You can take that half, the $5 we give you, and buy any pizza you want. You'll pay the difference, but it has to be from the pizzeria down the block. So your employee can then look at the menu and go, maybe I just want a cheese pizza. Maybe the cheese pizza is only $8. You gave that employee $5 towards the pepperoni. So then they only have to pay $3 in this case towards the cheese. Maybe they do just buy the pepperoni and then they pay the other half, the other $5. Or maybe they look at it and they're like, I'd like to get a Supreme. The Supreme pizza might cost $15. You gave them $5 towards the pepperoni. So then they go ahead and pay the other $10 for the Supreme. But in the end, they get the pizza that they wanted, and you budgeted yourself at the pizza the business could afford. So when you take a look at this and you're thinking about health insurance, what you're doing is you're making a decision on what carrier, health insurance company, you're going to offer your employees. You then find a plan from that company. You pay a contribution into it. And then the employees can buy up and down within the tiers and buy the one that best suits the benefits that they need during that year, that benefit year, and they'll pay the difference outside the plan that you offered. So that's one carrier. How does one level work? So again, you're going to share the cost of a pizza with your employee. You say, I'm going to offer you a pepperoni pizza. So you've decided what kind of pizza the employee is going to get. You take a look at the pizzerias in the area. You find a $10 pepperoni pizza from the pizzeria down the block. You tell the employee, hey, we can afford to pay for half of the $10 pepperoni pizza from this pizzeria, but you don't have to get it from that pizzeria. You can buy a pepperoni pizza from wherever you'd like. It just has to be a pepperoni pizza, and I've given you $5 towards it. So very similar to one carrier, the employee can then look at the pizzerias in their area, see which one they want to buy the pepperoni pizza from, and they have $5 in this case towards that pepperoni pizza, and they will pay the difference for the pizza that they choose for at that pizzeria. So when you look at this in one level, what you as a decision maker is doing is choosing what benefit tier you're going to offer your employees. then choosing a carrier's plan from that benefit tier to pay into, and then allowing your employees to buy across that benefit tier and choose the plan from the carrier that best fits their network needs, who has their doctors in it, and they'll pay the difference. Okay, so now I'll move on to the option for rebates. And one of our biggest drivers and incentive thing is our Connect Well Wellness Rebate Program. Through Connect Well, businesses can qualify for a rebate if they have 25 or fewer enrolled employees. And to participate, employees can choose from more than 30 of the pre-approved qualifying wellness activities. In order for the employer to receive the 15% rebate on their contributions towards the premiums, they have to have at least 1/3, 33% of their employees participate in a wellness activity. And when I say of their employees, I mean their enrolled employees. So if there's 3 enrolled employees and 1 employee participates and successfully completes one of the wellness activities and submits it, the employer will receive back at the end of their year, plan year up to 15% of what they contributed. Employees are also incentivized for completing a wellness activity, and they will receive a $100 Visa gift card. Just to give you an idea of some of those wellness activities, they are focused on mind, body, and money. So as you can see, there's options such as meditation, going for your well visit, taking a retirement planning course, and all of these are available on our website. An employee can go in, look, see what's available, and go ahead and upload their activity. So just to let you know, we are completely here to support you through this, through your benefit year, and make sure that you and your employees make the most of the wellness rebate program. And so if you are qualified to participate in the Connect Well program, we automatically enrolled you. You don't have to ask to be enrolled. Then about 2 weeks after your plan starts, both you and your employees are emailed about this Connect Well program, telling you how to participate in it, what are the options. Then employees, once they complete their activity, they will go ahead and submit a proof online on our website. And once that activity is approved, they will receive a $100 Visa gift card. Now, once your group has reached 33% participation, we will update you and let you know that at the end of the year, you will be receiving a rebate back. And then at the year's end, you'll receive some information and some forms to fill out so that you can receive the rebate back. And again, this is actual money back to you, not money off of next year, not a discount off the current year. It is an actual check back to you for up to 15% of what the business contributed into the employee's premiums. And just to show you that this is real, prior to us going all remote, we went out on a little tour and we provided these checks to Connect Well recipients. And here is one that said, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So really quickly, there is another exclusive way to get money back as a small business on the Health Connector for Business, and that is the Small Business Healthcare Tax Credit. Just to let you know, the Small Business Healthcare Tax Credit is a federal tax credit. And the reason we bring it up here is because only groups, small employers who offer health insurance through a state marketplace can even think about seeing if they're eligible for this, because one of the requirements is be enrolled on a state marketplace. And the Health Connector for Business is what the small business state marketplace. So once you have enrolled on the Health Connector for Business, this is your opportunity to open this up to your tax professional, your accountant, whoever handles your taxes, to see if you meet the other requirements for this federal tax credit. And there are a couple of them, as well as we have a link right to the IRS site so that you can review and see if you might be eligible. But once you enroll your group on the Health Connector for Business, it should be something that you bring up to your tax professional. So now that I've spoken about all these great benefits of utilizing the Health Connector for Business, you're probably like, how do I go ahead and get started? Well, it's really easy. First of all, you come to our website, which is mahealthconnector.org/business, and you create a employer account. Remember, everything's online. In your employer account, you'll create a benefit package, upload your employees, and then you'll offer your employees health insurance by the 10th of the prior month that you are looking to be effective. So for instance, if you're looking for a 9/1 start date, which just to let you know, small businesses can start their health insurance on the 1st of any month. There's no close or open enrollment period. You would have all of this done in your employer account by August 10th. Then your employees will all receive emails that tell them to go in, create an account, and enroll or waive with a valid waiver. And they have to complete that by the 20th of the prior month. Then there is an online payment that is needed to actually activate and make your health insurance effective. And then your coverage will begin on the 1st of that month that you are offering it. And just to let you know, the health insurance on the Health Connector for Business is an anniversary date renewal. So if you enrolled on 9/1, the business's plan will renew on 9/1 of the next year. So full benefit year. And as I stated in the beginning, many employers find the use of a broker as one of the benefits. And just remember, the brokers are here and they are available for you to assist you. We have over 470 certified brokers on the Health Connector for Business. They're free for you to utilize for any Health Connector for Business related items. It's very easy for them in their portal to create quotes for you, go over cost estimates, share with you what is needed for different plans and what it might look like. This is even without you making an account yet. Just to remind you, this is what brokers do day in and day out. This is what they are experts on. So allow for them to really take a look at what you need and provide you with the plan that best suits your group based on what you guys have spoken about. And again, they're a great way for you to save time and for you to focus on other areas of your business that you might have to invest a little bit more time in, and then they can do the work for you on the Health Connectors for Business side for your health and dental insurance needs. So now I'm going to turn it over to my colleague, Nikki, who will speak a little bit about the opportunities for sole proprietors, owner-onlys, entrepreneurs, and anybody else who needs access to health insurance that cannot get it through their employer.
Thanks so much, Shaitra. And again, thank you everyone for joining today's presentation. It's great to see so many of you on this summer day. Or see so many names that come across the screen on this summer day. So if you want to go on to the next slide, I want to talk a little bit about all the plans that are sold on the Health Connector, whether they're sold on the individual and family side or Health Connector for Business side. So the first thing I'd want to acknowledge is that all of the plans that we have on our product shelf meet state and federal standards for coverage. So for those of us, all of us in Massachusetts, I think one thing that really means to us or for you is that you never have to worry that when you're getting coverage through the Health Connector that you could be penalized on your state taxes for not having coverage that's comprehensive enough. And also, this is peace of mind, knowing that you're enrolling in a comprehensive health insurance plan. So to move to some, health insurance speak, every health and dental plan sold through mahealthconnector.org, sold through the state's Health Connector, is known as a qualified health plan or a qualified dental plan. So as Shaitra mentioned earlier, we have a variety of plans, we have a variety of carriers available across Massachusetts. So based on where you live and some other preferences, you can shop for a plan that truly meets your needs. Now, unique to the state's Health Connector, we offer health plans and you're able to get advanced premium tax credits if you qualify. And again, this is because we're the state's marketplace. So you can qualify for advanced premium tax credits, which essentially reduce your cost of monthly premiums. So I'll dive into that a little bit deeper in a few slides. On connector care plans, I want to talk a little bit about that because that is specific to Massachusetts. Now, these are plans for people who are in lower income ranges, who meet other eligibility requirements. And essentially, these are comprehensive plans And if you are eligible for these, you could be paying no premium or a very low monthly premium. So this is a very, very good offering that we have. And Shaitra and I have been, talking about this since the two of us have met. We see the Health Connector for individuals and families. All of these offerings are truly great offerings for sole proprietors, for people maybe who have just started a business. A lot of times we've heard that, people aren't even drawing a salary as their business is growing. So again, this could be a good way to start off, through the Connector Care program. And then as your business grows and you have employees, et cetera, you would be moving on or could be moving on to Health Connector for Business. Other things of note here, we do sell catastrophic plans, and these are plans that are available to people who are under 30 years of age or have a hardship exemption. Now, when you are looking at plans on our website and you see the cost of these catastrophic plans, they could be appealing to you because of the low cost. But my little buyer beware message here is that, you just want to pay very close attention to any plan that you are interested in buying, interested in enrolling in, because you do have a monthly premium, but that's not your only expense when you are, purchasing health insurance. When you have a service done, or you go for a service, or you are picking up medications, et cetera, there are costs associated with that. So with these catastrophic plans, sometimes the low monthly premium is very attractive. However, at point of service, you would be paying more. So members enrolled in that would be paying more. Now, moving on to dental plans, Shaitra mentioned dental plans a bit, but I just want to acknowledge that they're available for individuals, families, children, small employers. We have pediatric only plans. We also have plans with lower and higher deductibles. So we have a few options there if you're interested in getting dental insurance as well. And I won't spend much time on Health Connector for Business because Shaitra covered this all, but any of these standards that I've described are standards that Health Connector for Business follows as well. Now, I mentioned open enrollment on this slide just to acknowledge that we are not in an open enrollment period. So typically our open enrollment period runs from November 1st through January 23rd every year. Now, this is something that's different for the individual and family side than it is for Health Connector for Business. Health Connector for Business does not have an open enrollment period or any time frame that's closed. But on the individual and family side, during this time frame, you can come in and apply for health insurance and you don't need to have any type of qualifying event. When you come in during open enrollment and shop, coverage begins on January 1st. Now, we always tell people, if you don't have health insurance coverage, don't wait, just apply. You might find out that you have a certain qualifying life event that could open a special enrollment period. And sometimes people find out based on their situation, you could find out that you qualify for Mass Health, which is our state's Medicaid program. So there really is no need to wait. You never know. Everyone's circumstances are different and they change. So we just say, if you need it, apply for it and let's see what happens. Now, the last bullet here just notes that all Health Connector plans, whether they're health or their dental coverage, they start on the first day of each month. So we'll get into payment deadlines in a slide or two, but we just want to acknowledge that if you apply, enroll by the 23rd of the month, you can get coverage as early as the first day of the next month. So I mentioned, if you need coverage, no need to apply because you could have a qualifying life event. So what are those things? These are things that include a change in your household size, maybe changes to income. Let's say someone's immigration status changes, or you simply move from one part of Massachusetts to another part, or you move into Massachusetts. Also things like getting married, having a baby, adopting a child. These are all things that will open a special enrollment window. Now, if you have a qualifying event, you really do need to report it within 30 days of it occurring. And then you have 60 days from the date of the qualifying event to select a new plan. So during this special enrollment period, of course, payment and enrollment deadlines still apply. But again, I think the key takeaway on these last two slides are simply, if you don't have coverage and you need it, apply, and let's see what steps you can take. Now, what are the other requirements about getting coverage through mahealthconnector.org? So in order to apply here, you need to live in Massachusetts, you need to be a US citizen, US national, or otherwise lawfully present in the United States, and you need to be someone who doesn't have health insurance. So if you have Medicare, you already have Mass Health, or you have other public health coverage, like certain veterans benefits, you shouldn't apply, because you have this coverage, and as you're coming through the system, you actually won't be determined eligible. Also here is if you have an offer of affordable comprehensive health insurance from an employer. It doesn't have to be from your employer, but it could be from a spouse or a partner. If you have access to coverage, or as you can see the last bullet here, you're incarcerated, you're in jail. Yeah, these are truly, coming here and shopping is not for you. Now, on to the next slide, you may be wondering, all right, well, so what do I need to do? What kind of information do I have to gather? So here's a short list: Social Security numbers for everyone who's applying, if you've got them. If there are any immigration documents that you have, for anyone who's a non-US citizen, gather those as well. If you are applying for help paying with your premium, and I honestly would suggest that anyone who doesn't have health insurance coverage for any reason, don't think, oh, this isn't for me, I might make too much money, etc. We have an estimate tool, get an estimate tool on our website. And because we've had some flexibility due to COVID, due to the American Rescue Plan, and many more people are getting health insurance and getting some savings. So, we really, really encourage people to take advantage of this while this is available. So we would need recent pay information. So if you're self-employed, we'd need to know about your net income. If your income is different from last year, or you didn't file taxes, or things are very different, we definitely need information about your current income. If you have any pay stubs, we would need copies of those. And if you are collecting unemployment, if you're in that situation, we would need information about your monetary determination. And that's something, if you're collecting unemployment, that's something that you would be able to get either on your award letter, or you would be able to get it online through the state's website. Now, if you don't have any of this information that's listed on this page, again, can't stress enough, just apply, and we will reach out to you and ask you for more information. In fact, if you are going through the online application, and people will say, well, how long does this take generally about? And I'll say, yeah, maybe like 45 minutes to an hour, depending on how complicated or your household is, or how many people need health insurance coverage. When you get to the end of the screen, you're going to see a result for what you are eligible for. And if there are any documents that we need from you, you will see that listed as well. And you'll see timeframes for getting that material back to us. Now, I mentioned that I would talk about this a little bit more. So because we are the state's health insurance marketplace, if you apply through us, you could qualify for advanced premium tax credits. So as I mentioned, there are more advanced premium tax credits available right now due to the American Rescue Plan. So advanced premium tax credits lower the premium amount that you would pay each month. This money does not come to you directly. Instead, the IRS is going to send those dollars to the insurance company. So you will simply be paying less each month. Now, really important here is that these are tax credits. These are advanced tax credits that you're getting to save on your bill. So at tax time, you need to, file your taxes, reconcile what you received, and you'll basically get a tax form from us that explains your tax credit. And because this is a tax credit, as a consumer, you can choose to apply all that you were eligible for, or just some of it. You get to make that decision. Now, for those of you who are eligible for the Connected Care program, you may be wondering, okay, how are all those savings coming together? And that's because we're using this federal advanced premium tax credits plus state dollars, and those two together reduce the premium amount that you pay each month. Remember, the Connected Care program has low monthly premiums, low out-of-pocket costs, and very important, there are no deductibles. Now, when you apply, if you in fact were determined eligible for Connected Care, you would see that you are going to be determined for a plan type. And you could choose a plan for as low as $0 or $134. So depending on the plan that you choose in your plan type, there is going to be a variance in the cost each month. So going on to the next meeting, you'll see that there are some income guidelines. So you might be wondering, okay, what does this mean for Connected Care? How about advanced premium tax credit? So as an example, if you're let's say it's just you and you're a sole proprietor, you're getting started with this business. If your income is $38,280 or less, you could qualify for advanced premium tax credits. Now, going on to the right here, where you see APTCs and you see 400% FPL. Now, that income limit has been lifted. So because of the American Rescue Plan, that income limit is gone. And basically people with incomes over 400 could be eligible for help paying for their health coverage. So I would go to mahealthconnector.org. There is a get an estimate tool there, and we can put that link in the chat if it's not already there. But you can certainly check this out and see if you may be in a situation where you could qualify for some savings. So on to the next slide. Just like Shaitra mentioned, the brokers, we have free help to help you on the individual and family side as well. So you can get free help through our customer service center. You can get free help through our community partner organizations. In here, you're seeing our phone number for customer service, which is 877-623-6765. If you want personalized support, maybe in person or in a language other than English, also know that we have trained and certified navigators as well as certified application counselors who work in the community. They speak, languages typically representative of their community in which they live or work. And I believe a link just came through the chat where if you want to find some free help near you, you can go to either a navigator or a community, excuse me, I'm used to the acronyms. I don't want to do that to you. An assister, basically, in your community who could help you. And particularly right now, I'd recommend that you call ahead, schedule an appointment. These folks are able to help you over the phone. They can help you in person. They can help you over Zoom. So you just have to think about what your preference is and then call and schedule a time. So on this slide, we're nearing the end here, and I just want to go over a couple of reminders and details about shopping and enrollment on mahealthconnector.org, whether you're shopping as an individual, family, or small business. So I'll start this off a little bit, and then I'm going to hand this over to Shaitra. I think the real point I want to make here, and I think both Shaitra and I have said it, is that if you are a small business owner and you don't qualify to shop and get coverage through Health Connector for Business, you can still get coverage through our website at mahealthconnector.org. Now, I've mentioned that there are some deadlines. So if you're looking for coverage for August 1st, you're going to need to apply, compare your plans, enroll in a plan, and pay your first premium by the 23rd of the month before coverage can start. So looking ahead, if you were looking for coverage to begin August 1st, you would need to take action before July 23rd. Technically, you can also choose to have your coverage start on the second month after you enroll. And here, I just want to hand this over to Shaitra to walk us through some dates and deadlines on Health Connector for Business side.
Thanks so much, Nikki. And very similar to the small business employees and owners who do not have access to health insurance through their employer coverage. If you were a small business owner that you do want to offer health insurance through the Health Connector for Business, because it's not just you enrolling, you do have employees who are enrolling, then there are very similar deadlines on the Health Connector for Business. The 23rd is our key, similar deadline, and that's the payment deadline. But before that, there are a few more deadline steps for small businesses, and that's because you are offering the health insurance to your employees. So just remember, similar, if you wanted August 1st health insurance, you would have wanted to offer your employees the health insurance by the 10th of this month, so July 10th. Then your employees, they have to take a step, and they would enroll or waive with a valid waiver. And when I say valid waiver, that means they have health insurance elsewhere by the 20th of the month, so July 20th. And then we would ask for payment by July 23rd, and the plan would become effective on August 1st. So very similar enrollment dates. And with the Health Connector for Business, and Health Connector is pretty much the same every month. So you can just go in and follow the same deadlines, both for the small business health insurance and individual health insurance. So I think it's time to turn this over to Melissa and see if there were any questions for myself or Nikki.
Yes, there are a few questions. So I'll go ahead and start with those. So if I'm a business owner without employees who hires an employee during the year, can I enroll in Health Connector for Business mid-year?
So Nikki, I'll start with my part, and then you can start with how they can come off of the individual insurance if they are on it. So just remember, for small business health insurance, you can start a plan on the 1st of any month during the year. So yes, you can start your business plan on the 1st of any month. And that way you can offer yourself and your employee the health insurance starting that first. Now, Nikki, if they are enrolled as the business owner on the individual side, what would be the steps for them to discontinue that individual health insurance and go on their business plan?
Thanks, Shaitra. So what they would want to do is be sure to keep the 23rd in mind. So if you are enrolled in a Health Connector plan through mahealthconnector.org, you're going to want to cancel before the 23rd of the month, so that you've taken all the other steps on the Health Connector for Business side, and you won't have duplicate coverage.
If I'm an employer based in Massachusetts, but my employee lives out of state, can the employee still receive Health Connector for Business coverage?
Yes, but if you recall, we discussed the different benefit models. So one plan, one carrier, one level. So if your employee lives out of the state, you would want to give them access to enroll in a PPO plan. So that allows them to be out of network. And so you would want to offer a one carrier model that has a PPO in it, so that your employee can choose the PPO if they are enrolling in the health insurance coverage. So remember, with the one carrier model, the business can pay into any plan from that carrier and then allow that employee to take that contribution amount and put it towards the plan they need.
Can I offer coverage to part-time employees?
Yes, you can. The key, though, is you are required to offer health insurance to all your full-time employees, and full-time is 30 hours or more a week. And if you choose to offer it to your part-time employees, then you offer it to all your part-time employees also.
How do I hire a broker? Can they help me choose the best plan for me and my employees?
So hiring a broker is very easy. You can look them up two ways. There is the find help tool on our website. So you can look them up, put in maybe your zip code, find someone, call them, tell them you're interested in the Health Connector for Business, and you guys can have a discussion. They can start running you quotes. Now, if you've already gone ahead and created your employer account, you started shopping around, you're not really sure what you want to do, and you want to seek assistance, you can go in your account and there is a tab that says brokers, and you can search through brokers right there, choose one, assign them, and they'll get a notification and they'll reach out to you and help you. Now, you can go either way you would like as far as enrolling on the Health Connector for Business. You can go ahead and do this yourself if you would like. It is a self-service model, or you can seek the assistance from a broker if this is something that is not something you want to do on your own.
So I know that employers can get coverage elsewhere like HSA. What would you say are the main benefits of choosing Health Connector for Business over another platform?
So our main benefits are those very key ones that I pointed out. Our employee choice models that allows for the employer to create a budget plan or a cost constant plan while allowing their employees to choose the plan that best fits their needs. We have our Connect Well Wellness Rebate Program, which is also exclusive to us. And also, again, if you recall, I said you can ask your tax professional to see if you're eligible for the small business healthcare tax credit, because that is only available if the other requirements are hit to employers who offer health insurance through a state marketplace. So there's a couple of great benefits of utilizing the Health Connector for Business if you so choose to shop through us.
Great, thank you. I think that's all the questions that I see, unless there's any that anyone has last minute, but very good questions. All right, well, if that's all, then I'd like to thank you all for joining our call today, and thank you to my colleagues for helping to support today's presentation. So from everyone at the Health Connector, thank you, be safe and be well.